Well, good afternoon. Thank you so much for joining us. I'm Josh Schimmels, publisher and CEO of the Los Angeles Business Journal. It's an honor to host today's panel discussion on executive wellness. There's never been a more important time to address the significance of maintaining health than there is today. Our communities have been through a tremendous amount of change over the last year, and it's vital that we prioritize the mental health and the wellness of our leaders, colleagues, and all of our teams. In just a moment, you're going to hear from our expert panelists as they discuss topics such as mental health, telehealth, nutrition, stress management, how to improve work-life balance, and ultimately, how to implement successful executive wellness programs into your organizations for your executives and then also your team members. Many thanks to those of you who submitted questions during the registration process. You've actually helped us shape the conversation as we were able to incorporate them into the Q&A. During the interactive portion today, we'll be conducting live audience poll questions. So when you see these pop up on your screen, we encourage you to respond and to share your thoughts. We'll then publish the results of the poll questions online on our website, and that's labusinessjournal.com. I also want to thank our amazing group of sponsors who've joined us for this important initiative: Chicago School of Professional Psychology, Memorial Care Miller Children and Women's Hospital Long Beach, Mental Health America of Los Angeles, and PIH Health. Thank you guys all so much for supporting this program and, of course, everything that you do in our community of business. All right, we've got a really great conversation ahead of us, so we're going to hop right into this. It is now my pleasure to introduce today's speakers. First, we've got Dr. David Iwane, Vice President of Human Resources and Associate Professor in the IO Business Psychology Program of the Chicago School of Professional Psychology. Next, we have Jackie Keller, Founding Director of NutriFit and Board of Directors for Foundation of the Women's Presidents Organization. Chris Miller, President and CEO of Mental Health America of Los Angeles. Graham Say, Chief Medical Officer at Memorial Care Miller Children's and Women's Hospital Long Beach. And lastly, today's moderator, Denise Pines. She's on the board of directors with Federation of State Medical Boards. Denise, welcome, and thank you so much for being here today.
Thank you, Josh, for having me. I'm really excited about this conversation. It's so needed. Welcome to our panelists. I'm so glad we're about to have what I think is a really important conversation. There's never been a time in modern history that we've had such a focus on health and also on technology. And as we begin to return to work now and through the fall, we have an opportunity to really help improve the quality of life for our employees and our colleagues. So let's get started by first understanding what are executive wellness programs and how can we implement them? David, I'm going to start with you on this.
Okay, thank you, Denise. So executive wellness programs are really an offshoot of corporate wellness programs, which have been around for decades. And they are workplace health promotion activities designed to support and promote a healthy workplace, but with a more narrow focus towards the physical and mental health of leaders and executives within organizations. Now, being at the helm of a large company or an executive in the C-suite generates a unique level of stress and pressure that must be addressed in order to adequately support these leaders. And research has found that companies are more profitable with healthy executives. Investments in wellness programs show positive results on investments. Aside from just the healthcare costs, the financial benefits of executive wellness programs are immediate and obvious. Healthy executives are more attentive, they're less prone to burnout, and generally more productive. Getting an effective wellness program deployed is no easy task, however. It often requires a cultural shift within the organization itself, a new emphasis on health and wellness that must be expressed and lived from the top to the bottom of the company. And effective wellness programs aren't just standalone projects either. Their goals must be sewn and intertwined within the policies and procedures, even in the organization's behaviors, because you really want to make this part of the organization's now DNA. So the best way to ensure wellness program success is with buy-in from the entry level to the executive suite, and the best way for leadership to encourage employees to participate and therefore generate some of these benefits that we know these programs can produce is to really demonstrate their own support and enthusiasm for wellness.
Great, thank you. Chris, I'm going to go to you and ask, how do you implement an executive wellness program?
Well, I think one of the most important things that you need to do is to talk to the people in your organization, to the people who are going to be benefiting, and really find out what they're dealing with and what they most need. A lot of times it can be surprising. In our agency, we were going to offer something. It was not for executives, but for our staff. But we sent out a brief survey, and it turned out that they didn't want to have group listening sessions. They wanted the organization to invest in resources that would allow them to get therapy outside and to help pay for that to offset the cost. The same thing applies with executives. It's really to take the pulse of where they are and see what they need. The one key in David did a very good description. I'm sorry, was it Graham who just, it was David.
David.
Sorry. It's a very good description. The one thing I would add to that is to just realize that it's not all or nothing, and you can start an executive program in a small way. It can be something that you devote an hour a week to over the course of a year, or it can also at the other end be more intensive, where people are involved for days at a time. And I think you need to look at within your own organization, which is going to work better for you, and also what are people able to respond to.
Great. Graham, so sort of on that, still on that same line of thought in terms of executive wellness programs, how have you seen implementation?
Yeah, I totally agree with it doesn't have to be all or nothing. You have to really assess what your team and your workforce needs, and one size absolutely doesn't fit all. I want to talk about just briefly about there's wellness, which kind of refers to the physical wellness, but we really have to focus on well-being, which is the whole person. And there's many different dimensions of a wellness life, and it can include career well-being, social well-being, financial well-being, obviously the physical well-being, and as well community well-being. And everyone has different stress points. Everyone has different priorities or where they're hurting. And so implementation really has to take an assessment of depending on how large your organization is, the variations in your workforce, and try and address what you can and the variations within there.
Great. Jackie, Graham just, sort of mentioned it's not just one dimension. You focus on the nutritional aspect. So tell me about, wellness programs and implementation around nutrition.
Well, everybody is kind of touched on the same aspect of whole person, whole being concept. But when it comes to nutrition, it's particularly important to realize that your nutritional status is a function not only of what you eat and what you drink and your overall general medical state, but it's also, it slops over into your family. It slops over into your employee cafeteria, your workforce area. And I think we are really opening up a whole new dimension of health when we start talking about nutritional status as it affects these other aspects of health, because your nutritional status affects your sleep affects your stress affects your performance at work. So it's important to look at what are the other factors besides just the basic, am I eating enough fruits and vegetables a day? I mean, there's a lot of questionnaires that talk about basic nutritional status, but not a lot that talk about what other resources do you have for feeding yourself? Do you have challenges with feeding your family? How do you address those challenges? That's a bigger question, and I think one that needs to be asked when you're doing an assessment to see what kind of wellness benefits do you want to offer. And there's another thing, Denise, that I think is apparent in the conversation that's happened just so far in the few minutes we've been talking. One is the executive wellness as it pertains to the executive. The other is the corporate wellness as it pertains to the employee population. And when we start to talk about the expanded version of well-being and how it affects the bottom line of the corporation, I think we need to look beyond just what's happening with the executive himself or executive team, and also look at what are the benefits that we're offering to the employee population that they can take advantage of when it comes to improving their nutritional status. And that's one of the reasons why my company exists, because we offer those solutions. But besides that, I think the bigger question is, what is the executive wellness program? Is it just for the executives, or is it for the employee population as a whole? The whole definition of wellness has changed.
I totally agree about not just the executive, but also the employees, but I know we're focusing on the executives at this point. Chris, how has the past year, and I know this is a loaded question to even ask, affected the mental health and wellness of our executives and team members?
I think it's affected all of us, whether they're executives or just the whole world in general, in a very unique way. There are regular, more day-to-day stressors that people go through and major life events. The past year has been really unique in many ways. I think the most significant part is that it's really hit people close to the core of what matters most to them. People went through a lot of vicarious trauma. If you watch another person suffer or die or experience pain, you yourself have a lot of emotions in response to that. Everyone varies in terms of how you're going to respond, but it can have a profound impact on you. And everyone was experiencing in different degrees. People would say, oh, I'm not watching the news, but you can't really shut out what's happened over the past year. I have colleagues who were not planning to retire, but a lot of them have retired. Other people have tried to change careers in the midst of the pandemic. People have moved, they've moved to different parts of the country. There's a lot going on that's connected with people reassessing what really matters to them. Because when something this significant happens, and I'm talking about both the violence that people witnessed and the health threats to the world and to our country that people saw over time, it's really affected the mental health of everyone. And leaders who are trying to keep an organization going, in the midst of that, it's been especially stressful in terms of how it's impacted everyone.
Yes, I totally agree. We didn't just have sort of one thing happen. We didn't just have a pandemic, but we also had a sort of conscious rising happen as well on top of that. So I agree that was more than just one thing. David, you did a great job on giving us a great overview on how the executive wellness programs kind of work and how they're attributed and associated. So what do you believe or are the attributes of the most effective executive wellness programs, and why?
Okay, well, obviously the most effective wellness programs are really those that work for your particular organization, right? Take into consideration all factors such as the cost, the size of the company, the effectiveness of the wellness programs, are also utilization rates, right? You want to make sure that one measurement is to see if people are actually utilizing some of these programs that you have in place. I believe you have to customize programs a bit for your workforce and executives to be effective, and this might take some trial and error. You really have to focus in and see what really works best for your group. Now, while a large percentage of executives would agree with the concept, most surveys show that the same executives are only investing very little time in their overall health. That includes, time devoted to preparing meals, exercising, monitoring their health, or other activities. And the experts will say that, there is a minimum threshold that you really have to put in there in order to generate some beneficial results for these investments to pay off. And over time, the initial enthusiasm for these new programs begins to wear off. I think it's generally fairly easy to introduce a program, get everyone excited, achieve some level of success. However, the effective programs are really ones that are sustainable. So, as the others were talking about, it doesn't have to be an all-in approach for this. It could be customized. You could do it in parts. Sustainability success can be attained really through education, accessibility, consistency, and really enforcing the behavior. And again, as I stated earlier, this could include aligning organizational policies and procedures really to support these efforts, to really make it a part of the culture of your organization.
So David, give me an example of that. Like, I want you to kind of elaborate, like when you say enforcement of that, policies to enforce, just give me like an example of like how that would work.
Well, I think what it would be is that you could have time off, mental health time off. I mean, so you really want to, and really where the sustainability is going to happen is if the workforce, we're talking about corporate wellness, if the workforce could really see this as a top-down driven, and they could see that their executives are part of these programs, those are very, very sustainable practices. But you have to make it where it is accessible. People feel that they could use these programs. So, it would probably be part of their policies and procedures. It could be, maybe even a mission statement would be really good to kind of drive in. And we believe in, the overall well-being of our workforce, not only the executives of the workforce. So really adopt those type of practices and ingrain them into the institutions.
Great. Graham, I'm looking forward to asking you this question. So tell me some of the services, specifically technology, that your organization has embraced to support the well-being of your workforce, especially now during COVID.
Thank you. So on my campus, we have an incredibly diverse workforce. We have, I'm in healthcare, we have over 6,000 employed individuals, independent contractors, and a couple of thousand physicians. And we have individuals, obviously highly educated, as well as individuals in other areas that have very basic education. And so the range of options that we need to provide to our workforce is very diverse. And that's been one of our key learnings. It's really that individuals want a variety or require a variety of different access points for wellness programs and initiatives. And certainly one way or one program does not work for all. And in the options that we provided to our workforce, some have wanted that in-person contact. I mean, especially after this year during the pandemic where we've socially distanced, haven't seen loved ones. Individuals have certain individuals have wanted to have that one-on-one or even in group sessions and commiserate and share stories and be able to relay what they've gone through. Others have felt totally uncomfortable. No way am I getting in a room with anyone else, but felt comfortable with one colleague or one individual. Others have wanted total confidentiality and prefer the anonymous route of an employee assistance program, which we've always had, or spiritual care. Some like the web-based, but some of our workers don't even have web access outside the workforce. They have internet challenges and access challenges. Some people like the virtual, on an iPad or on Zoom. So we've literally provided all of those access points through several different programs. Important though is really getting our workforce to recognize when they are hurting and when they have stress points and when they perhaps don't even realize how affected they are. And we instituted an assessment tool where our workforce can assess their dimensions of well-being in 9 questions, takes less than 5 minutes. Do it on your cell phone, do it on the web. We provided other access points as well. And that was really well received. So I think the message is you have to have a quiver, a plethora of various options so that everyone on your staff has access to the options, the wellness options and the well-being options that you will provide.
I think that's great. You're right. We're all different kinds of people. We respond differently. Some of us, respond to technology. Some of us don't respond to technology. Some like to be touchy-feely. Some are not. So it's great that you have recognized these sort of different kind of components of how we are as humans. So Jackie, when it gets to nutrition, how does nutrition help executives achieve peak performance on and off the job? And then who helps them?
Well, help can come in many forms, Denise, and we are what we eat. I mean, it's been said over and over and over again, and Hippocrates said, let food be thy medicine and let thy medicine be food. So this isn't a new concept that what you eat materially affects who you are, how you feel, how you perform in life, no matter what level, at what level you function. Executives have an incredible amount of pressure. One of the things that we see all the time are people whose nutritional status is compromised because they have so much stress that they don't eat properly and they can't feed their soul or their body to perform optimally. So obviously people can turn to dietitians, they can turn to nutritionists, they can turn to services like the ones that we offer that offer a holistic health coaching approach to the understanding nutritional status. But basically, science has taught us that a well-rounded, well-balanced, carefully thought out meal plan is the one that really provides the best structure for a healthy body, and a healthy body fuels a healthy mind. It's very hard to be mentally healthy when you're physically unwell, and it's very hard to be, your mind can control a lot of your physical ailments as well. So the converse is also true. I want to make one point, Denise, if I can just backtrack to something that Graham said, I thought was really particularly significant when it comes to group, assessing the needs of your group and what to do on your own campus and how to feed in its not literal sense, all my metaphors are food related for some reason. Nourish, feed, I always pivot to that. I guess that's par for the course, but how to care for and nurture your employee population based on the fact that, everybody has a different approach. One of the things that we've seen is that people really gravitate towards, even in a socially distanced world that we live in, gravitate towards a common meal. And we used to be able to gather in the cafeteria, or let's all go out to lunch together, and have meals over a table. So I think it's important to know that there are options out there for people to gather virtually around a meal still. And those options exist to still bring people together in a nurturing, social sort of way without putting them in the same room. And that's important because I think the workplace has changed. But again, back to your question about how to feed yourself for optimal performance, I think science has taught us that the basic Mediterranean diet is the most beneficial for the mind. The mind diet is very closely related to the Mediterranean diet. So if you're looking for a simple solution, pivoting to something like that, which medical science has proven to be healthful and beneficial, is probably the best way to go.
Great. So I just want to kind of follow up on just a little thing about helping people. So a lot of times I know leaders and people who are speakers say, I cannot eat before I do a big presentation or something like that. What is something that they actually can do for those who feel they cannot do that?
Well, just from a nutritional standpoint, there have been some interesting studies on what kinds of foods produce calm in the body. And of course, we know that complex carbohydrates encourage the production of serotonin by the brain. And serotonin is the sort of chemical messenger that tells our body that all is right with the world and we can be calm and we can be relaxed. So I think it was actually 20 or 30 years ago, a scientist did a study on pure carbohydrate foods that produced calm. And the result of the study was that eating something as simple as a plain baked potato an hour before a stressful event produced the kind of serotonin release by the brain that produced a calm in the body. So for people who can't conceive of eating a meal before a presentation or before an anxiety producing event, I will often recommend to try, a very simple baked potato an hour before the event. Let your body, that's the purest form of complex carbohydrate, let your body absorb it and allow for the serotonin production to send out those chemical messengers from your brain that tells your body it's okay, you can relax, you can be calm. And it's very easily digested and very quickly put to use. So that's one little trick that I think really helps.
Great. I'm going to go get me a potato right now.
You're halfway through the event.
David, so how do we measure effectiveness of executive wellness plans once we put one in place?
So, there are a number of ways that you can measure the effectiveness of wellness programs, but you first have to establish the constructs by which you're going to measure. So having some pre-data like workforce turnover, absentee rates, production volume, health-related costs, these are all good starting points. Ultimately, however, utilization of the wellness program would probably be one of the best indicators and measurements. As we discussed earlier, in the program, the utmost importance really is around sustainability and making sure that, that it is constantly being used and utilized. Executives, because, this really is part of a behavior modification that is going on within the organization if you haven't already have something in place right now. So you just want to make sure that, some of these things are actually working. You can even start off real simply with a question or a survey to capture some baseline data to measure. And then after you formally start the program, start measuring and analyzing the results. Where were you in the beginning? Are we seeing any positive beneficial results from this? And then really incorporate some cycles of learning to consistently improve upon your program. You'll probably notice, things like decreased workplace conflicts, higher levels of engagement, and even improvement in the workforce culture itself.
Okay, great. Does anybody else want to comment on measurement and the effectiveness of these programs? Nope. Okay. More and more often, Chris, what's resilience? We're hearing this term more and more now, but what is it, and how what helps leaders and people in general be resilient?
There was some great research done a while back, especially, let me start with leaders, on hardiness. And in fact, the work focused on people in hard driving leadership roles. And what they found was that they called it the 3 C's. There were 3 things that really helped people be hardy. It was commitment, control, and challenge. And as leaders, we have a lot of that. We're very committed to what we're doing. We have a lot of challenges every day. And we have even though we have a lot to do, we have quite a bit of decision-making latitude and control over our day-to-day events. What got added on after this research had been going for a while was the fourth C, which was connection to other people. And that's kind of come up lately, especially during this pandemic, as the most crucial factor. There are a lot of, and there's been some wonderful description of it by my colleagues talking about the array of programs that you can do and the importance on a broad range of them. But one of the things that right now where we're at as a country, and both in terms of leaders and employees in our organizations, is we've been isolated for a very long time. It's the social support we get from people really helps make us resilient, and it's a key resilience factor. So that's a key area to focus on no matter what you're doing, is to set it up in a way that people can actually connect. In our organization, I asked everybody, we have 400 employees, and I said, I want you to call 2 people every day, whether you know them or not, and just talk to them, giving them permission to just introduce themselves to someone from another department, whether it's by phone or Zoom or any way at all, just to keep those connections going. And I think the more you can encourage both your leaders and your staff to do that, the more it's going to help them come out of everything we've been through this past year.
I think that's really great. I've actually had to jump on flights. I've probably been on 10 since last May, but just recently, basically last Friday, I was on a flight, and I have to say, just the whole getting to the airport, it felt all back to normal pre-COVID. And I really had a lot of anxiety around like the diverging different people, personalities, viewing all of that. I just felt really disrupted. So I think the process of getting back and starting to connect with people before they submerge themselves back into a work environment that has the variety of people is really good advice. Graham, what has been the feedback from your teams? How has staff responded to handling wellness services that you mentioned earlier?
Yeah, thank you. It's been really positive, and I think the overlying themes of gratefulness and appreciation, I think some of the most resonating feedback has been how our executive leadership, all the way from our system level CEO and president, acknowledging, this has been a terrible year. Everyone is hurting. Everyone has had stressors. Many people know individuals that have died, and that it's all right to be not right is, a phrase that we've used. And people have given us feedback that's really reassuring. Mental health still has negative connotations, and the workforce seeing their leaders recognizing and acknowledging the struggles that everyone's going through has made an impactful difference in the workforce, for sure. And that we're going through it all together, and that the entire health system is really there to support each other, that we're going through it as a team. I think it's really challenging now. We've made it very front and center, and we'll continue to do so. I echo David's comments. Sustainability is really putting your money where your mouth is, making sure that what you put in place now is going to continue 3 months from now, 6 months from now, a year from now, literally forever, because well-being and wellness needs to be the fabric and your culture of the organization.
Totally agree. Where does the oversight really fall? Is that in HR? Because we're talking about executives. So where does that really fall in terms of making sure that this isn't, to your point, like lip service, that we're really doing this 3 months in, 6 months in, a year, 2 years, 5 years?
I think it is everyone's accountability, but especially managers and executive leadership. You have to keep on coming back. You have to keep on touching base with your staff and saying, how are things going? Where are you? Where are you hurting? Or are you hurting? What do you need? What can we do to help support you? And it can't be just, here's the resources for you, go and do what you will with it. The executives, the management has to be front and center and participating and bringing it forward.
Okay, great.
And Denise, I would also,
Yeah.
agree, I definitely with Graham's statement there, that it really is everyone's responsibility, right? To there's a lot of transitional reluctancy going on there with the workforce. Is it safe to come back? And hopefully now, there is a vaccine out there that's going to be effective, right? So COVID really was a physical, phenomenon, virus that impacted a lot of people. People died, people got sick, right? And hopefully now that with the vaccine, you're going to have, the physical part will be okay. But I think really, the trauma that has been brought on from the mental health aspect is really one that's going to stick on for years, right? And you're going to notice a lot of these quirky type of behaviors in the workforce. And so, as Graham was saying, it's really important to ask those questions. Are you doing okay? How are you feeling? Be very observant in the workforce. I mean, you might have some people locked in their office and they're not going to come out, right? Well, you told me to come back to work and I am, but I don't want to leave my office. So there's going to be those type of nuances that we're going to have to work through. But, as leaders, we have to be aware of it, especially the executive leadership teams. And it's really everyone's responsibility.
I couldn't have said that better. Jackie, what are the easiest or first step changes people can make today to improve their health? And how can we motivate our employees to do so without really overstepping their boundaries?
Great question, Denise. Well, we know from coaching science, from positive psychology, I'm sure Chris would agree with me, that our strongest motivators are things that are internal. Intrinsic motivation is really what drives behavior change more than anything else. So what do I mean by that? I think it's important for us to look at and encourage not only ourselves, but our employees and our associates, our colleagues. Why is it important to be healthy? What's going to be different in your life when you achieve a modicum of health that makes you comfortable? Assessing those internal motivators first and finding ways to be mindful and reminded of them all the time is what's really going to drive behavior change. We know that external motivation only goes so far. What really propels people through behavior change and modifications in lifestyle that helps them is understanding what's important to them to begin with. And so finding out why it's important to you, reminding yourself through the process of your daily living why you're doing these things, why you're making these healthful changes. These are the things that are going to long-term make a difference in terms of employee health and wellness. So how can we get there? Well, there's a lot of ways we can reinforce it. I think both Graham and David talked about the fact that sustainability is really, really important, but you're not going to sustain behavior change or motivate yourself or anyone else to make those kinds of changes if you don't see a benefit to it, and constantly remind yourself that there is a reason why we do this. It's going to improve either your performance, it's going to improve your personal life, it's going to improve your sleep, it's going to improve your stress, it's going to improve your connections with other people. And I want to reference back to just one thing about connection, which Chris said, which is, I think, very, very important. And that is, a lot of times executives, it's kind of an isolated role. And I think even more so, given the year that we've been through, we've all been isolated from one another, but executives have been particularly put in a precarious position because they have to lead an organization where you can no longer walk down the hallway and see people and call a meeting and see everybody in the same place. So sometimes it's helpful to have an outside organization where you can find that connection with other executives and with other people who are business owners or business leaders, which is one of the reasons why I joined the Women Presidents Organization to begin with, just to find a group of people that I could associate with that were in the same status that I was. So those sort of social organizations that are business oriented are a good way for people and executives to stay connected to other people and to themselves. And I just wanted to mention that it is important to do it internally within your organization, but it's also helpful sometimes to have an external group that you can turn to that socially supports you.
Great. You didn't talk about habits. How does what you said evolve into habits? So evolve into where I don't have to,
Think about it.
yeah, for lack of a better word, psych myself up every day, right?
Well, there's the brain is a habit forming machine. And this is not original thought by me by any stretch of the means. I'm sure the scientists will agree that our brains crave habit. Why? Because our brains use up so much energy in the body that we want habits to be formed so that we don't have to constantly be thinking about what it is that we're doing. So how do you form a habit that is positive? You form it by habitually doing it. So if your habit is to try to eat more vegetables, to try to eat more consistently throughout the day at certain times, to try to drink more water, all of these are favorable health habits. We would all agree we should all have lots of vegetables, we should all drink more water, we should all eat more consistently throughout the day. How do you psych yourself up for it day by day by day? By making it habit. Your brain, you're training your brain to expect it, you're training your body to expect it, and your body will respond. Our brains are habit forming machines. And if we train our brains to positive health habits over time, and it doesn't happen overnight, but it does happen over time, and it doesn't take forever. It's about 64 days, I think, for your brain to form a complete habit. If you ritualize healthy behaviors, then you don't have to constantly be psyching yourself up for it because your brain is trained for that and your body is trained for that. It's like getting back in the habit of eating breakfast. If you're out of the habit, it takes a while to get back into the state of mind where breakfast is something you're hungry for. But eventually, if you do it consistently, you do get hungry for breakfast. And the same is true with other positive health habits. Train yourself, discipline yourself for the initial month or two that it takes for a habit to be formed. Make it a positive habit. Remind yourself why you're doing it, why it's important, why you sort of started down this path to begin with. And over time, it'll just be that. It'll be habit. And it frees up your brain to process other things. So your brain loves that. And your body will respond too. You'll feel better. And those are self-reinforcing positive behaviors that I think happen over time as we practice them.
Thanks, Jackie. Chris, so we just heard about habits. What are the best ways for people to take control of their work-life balance?
Okay, let me start by saying that it's important not to beat yourself up around this one, especially executives. We're not the best people at doing this. And in a pandemic, when you're working remotely, everything just mushes together. Your kids may come in with questions, you're cooking dinner while you're sending texts, and because you're not in the office, it can all just become one big blob. Technology has really helped us get through this. I've often thought, like, what would the last year have been like if we didn't have the technology to connect us? It would have been, even more difficult. But it's also been a challenge for us because it's constantly beckoning. And so I think you have to set some limits with yourself in terms of how quickly you answer that email, how much you check for texts. Do you ever just sit it down and focus? Because the act of being vigilant and constantly thinking is stress, and it really weighs on you over time. The other thing, we've talked a lot about, so many great points have been made about different ways you can take care of yourself, relax, be resilient. The one thing I would say that's the most important in this area is inject breaks that are deeply meaningful and enjoyable, whatever that is for you. whether it's nature, whether it's going for a run, whether it's just sitting down with your child, calling your best friend. I was sort of quarantining during this whole thing. I moved and I had a view of a bay in Long Beach and noticed the dogs were riding with people in boats and everywhere else. So I started photographing the dogs, and every time one was out in a boat or on a paddleboard, I photographed it. And just that was maybe 3 minutes of my time each day, but it took me away from the constancy of dealing with stressful and very demanding situations.
I think that's great. I think you're right that one way is really connecting with nature, because that's the kind of, that's the human part of who we are. So finding those aspects. And I did read that the adoption of cats and dogs really went up during this time. So people were looking for those, unconditional loving animals as well. So David, let's hear from you on how do you engage your executives and teams in a wellness program?
Okay, well, that's a really great question, Denise. Before you consider how you'll engage your executives and teams on the wellness program ideas, you need to really find out, do they support the idea of wellness programs in general? Are there any objections to starting or expanding an existing program? Where does wellness program stand right now? This will give you some good insight, not only on how to engage, but the odds of the success of the wellness program. So you'll find you'll need to explain some of the beneficial outcomes of the said programs. I think Jackie talked about it, what's in it for them. So you really have to explain those things, identify their goals for their program. And I think let the executives have some control over the programs that might work best for them and tailor some of it to their specific needs. Without a holistic approach to wellness, employees may miss out on important ways to really stay healthy. And sometimes, not always, getting executive and teams on board with their own physical and mental health may be, one of the greatest challenges, right? And sometimes it might take some prompting from maybe a board or somebody that sits at the very top. But generally, I would say that executives are pretty good about their wellness. As one has to really understand that the executive sitting at the top, really their decisions and their physical mental health really will trickle down to the entire organization. Think about when Steve Jobs at Apple's first encountered some health problems. Just the mere thought of his illness really sent shockwaves to the consumers, investor relations, and ultimately like stock volatility. So investing in executive leadership wellness is really good business. It's like an insurance policy against instability. And many companies now, they actually offer wellness type programs, as part of their overall executive compensation and benefit plans.
Yes, you're absolutely right. I remember a friend of mine got invited to an event that Bill Gates does at his property with all the sort of top 50 CEOs around the world. And the thing that stood out most to him was when he went to the gym, and it was like a giant gym, right? That at 6 a.m. in the morning, most of the CEOs were down there working out. So they do recognize that they do need to do it, and they do need to take care of their bodies. Graham, is there any ways that in which you engage your executive teams?
Yeah, thank you. I echo what David said. Coming from the healthcare industry, we've got a lot of data-driven individuals here. And I think it's really understanding that, acknowledging there's an issue, having them understand, what wellness, well-being is. And if you don't, you really don't see the ROI necessarily beyond, well, it's costing us this to have this program, and what are we getting back? We're not getting any financial rewards, but the benefits to a well-being program are huge. You know, we've discussed those. And I think getting the executives to understand that is important, getting the teams as well to understand this is goes beyond just, you know, feeling better or you know, eating better. This is truly your whole body well-being. And then I think for the executives, it's really, as we've mentioned, modeling the behaviors. It never sits well, or rarely sits well, if the executives are preaching one thing but doing the exact opposite. And so, you know, we as executives have to model the behaviors.
Yes, I agree. That's what leadership is, right?
Exactly.
Jackie, how can companies continue to build camaraderie in their workforces and among their executive teams in this new world of remote workforces? We know that companies right now are making really big decisions about what does their workforce sort of look like, and whether or not we go back to working all, you know, back into physical offices, or if we have a hybrid of working from home and working in physical offices. So what does like the transition back into office, you know, what can companies do to build camaraderie as that is about to happen?
Well, I think the remote workforce is here to stay. I think a lot of companies have realized that you don't have to gather everybody under one roof. I think the ramifications of the last year of distance working and working from home are enormous. And I think that it's going to change the shape and nature of corporate headquarters in ways that we won't go back to. So one of the things that we've done as a company is gathered people together virtually for a shared meal by sending the meals to the participants' home. We've had a lot of companies do lunches, do advisory board meetings, do social gatherings, do cocktail hours, but do it remotely by sending the food actually to the employees' homes, no matter where they live in the country. And it's been a wonderful success because it allows people to get together. Granted, you're in front of a screen, but you're all sharing the same meal, you're all engaging with one another, you're all drinking and laughing and talking in a very protected way. So I think as we transition from remote workplace to partially coming into the office or any kind of job sharing, you know, workplace sharing kind of environment that we find ourselves in, we need to look at ways for people to continue to gather, for people to continue to connect, and not have it just be a dry meeting. It can be a lunch, it can be a cocktail hour, it can be a tasting, it can be any kind of social event. It can be a retirement party or a birthday celebration or you know, a business meeting, anywhere where you would otherwise have a restaurant meal or have food brought in. Now we have ways of doing that remotely. And that's one of the things that we've been doing at our company, and we've seen tremendous success with it. So I think that's one thing that can be done and executives can do. And another thing, I think one of, I think it was David that touched on it, maybe it was Graham, talked about, you know, continuing to encourage people to socialize, or probably it was Christine, actually, Chris. I think you mentioned that, you know, allowing people to find the ways to connect that were most meaningful to them, whether it be through technology or through phone calls or through reach outs. I've had people do sending notes to each other. There's a lot of gamification where people all get together in a company and they participate in a game, but they do it online. These are ways to foster connections between remote workers and still kind of have a company culture around it. So there are those options, and I think that those need to be explored because I think those are going to be much more prevalent as we stop going to the office in a formal way.
So for our last question, I want to hear from each of you, but I want to give you about 30 seconds to just respond with tips that you have for executives looking to implement an actual wellness program. What tips do you have, David?
Okay, so 30 seconds. Well, my tip would be that, if you don't already have a wellness program in place, start one immediately. And if you already do, then double down, because the road ahead is going to be a rocky one, right? As we prepare to restart the economy and our businesses, bring back our workforce, we're coming off one of the greatest public health crises in modern history and maybe of all time. We're in the process of ending a year-long lockdown. Many of our employees are returning to the workplace filled with anxiety, not just about their health, but their economic future. So an investment in or a relaunch of current wellness programs with leadership at the forefront could be the best way to welcome them back. And it doesn't have to be overly complicated or complex to be effective. I think the key here is really just to get started.
Perfect. Graham, tips?
Yep. Shared accountability, but ultimately you need a multidisciplinary team to really, it takes a village to do this, what is culture transformation. And so again, changing your culture is first you got to define it, you got to align your workforce, you got to drive adoption, and then you got to sustain it. And so it's a journey, but take it piece, one step at a time.
Great. Jackie?
I think a lot of medical providers, healthcare companies that provide services. We have Kaiser as an example. There's a whole plethora of insurance companies out there that offer wellness program benefits. I know NutriFit has been providing wellness activities for many years under the auspices of healthcare companies. So I think if your insurance carrier has an option, look at it, because maybe that's a place to get started if you don't already have a program in place. And I agree with David and Graham. It is all about setting the example, walking the talk, being consistent, being noticed. And if you aren't going to be noticed physically, make yourself noticed technologically. I mean, find a way to encourage people to log into a system that keeps them accountable and keeps them focused. And do it quickly, because I think the guys are right. And Christine, I know, will echo this, that, it's going to be a rocky road. It is going to be a stressful time. It already is. So locking in the support of your insurance carrier, locking in the support of other organizations that provide services that will resonate with your employee population, that work for you so that you can embrace them yourself. That's the role of the executive.
Great. Chris, 30 seconds.
Okay, my main tip is engage your team. Ask for input, find out what they need, find out what they don't need. Make sure that each person has a role in moving forward with it. If you engage them early on, they're going to have more ownership, and it's going to be their effort. It's also good for your team at this point to really involve them in this.
Great. I want to thank our esteemed panelists for a really important conversation, and I hope our attendees learned how to enhance or even start their own employee wellness program or executive wellness program. As they say, our health is our wealth. So let's also thank the LA Business Journal for always bringing really interesting conversations like this one to the business community. I'm going to hand this back off to Josh now.
Well, thank you so much, Denise, just for a great conversation. I think at the end there, Dr. Awane said something that summed up, if you learned nothing else today, so simply, if you don't have a wellness program today, create one. And if you do, double down. I think those are great words, great advice for executives and for leaders and businesses out there. Dr. Awane, thank you. Jackie, Chris, Graham, and again, Denise, thank you for an outstanding discussion, a very important one. I want to remind each of you that Monday's edition of the LA Business Journal, so both print and digital versions, is going to highlight this entire discussion. And there's also going to be a feature with additional content from our experts. So you're not going to want to miss that. Speaking of missing, if you have colleagues and clients and family members and people that you think would benefit from this program who weren't able to join us today, there will be a recorded version of the entire program and discussion available on labusinessjournal.com that typically will be up in the next day and a half or so. And so you're welcome to reach out to us if you have any questions. Until we're able to meet again, please stay safe, everybody. Thank you all so much for joining, and we'll see you next time. Wonderful, and have a great day.